All right, let's talk about something most of us probably think is pretty simple: medical oxygen. It's a lifesaver for millions of people, but it also comes with a surprisingly strict rulebook, and for some really, really good reasons. So let's dive in and find out exactly why.
So when you think of oxygen, what comes to mind? Probably pure, clean, life-giving air, right? I mean, it's what we breathe. It's what you see in hospitals, helping people who are struggling. It just seems fundamentally safe. But here's a thought. What if I told you that in a medical setting, oxygen isn't treated like air at all? What if it's treated more like a powerful, prescription-only drug?
And boom, right there, that simple idea of safe, harmless oxygen kind of gets shattered. Get this. Official guidelines actually warn that in an oxygen-rich environment, something as simple as petroleum jelly, the stuff you might put on your lips, can become a potential fuel source for a fire. That's our first big clue that medical oxygen demands a whole different level of respect. Okay, so this section is all about looking at oxygen as more than just air. We've really got to reframe how we think about this. Let's move away from the idea that it's just extra air and start to understand it as a very specific medical therapy, one with precise uses and, yeah, serious risks if it's not used correctly. Right, so this brings us to what's called long-term oxygen therapy, or LTOT. This is the most common kind of home oxygen you'll see. And just look at that definition: at least 15 hours per day. Whoa, that tells you right away this is not for someone who just feels a little breathless now and then. This is a serious, intensive, long-term medical treatment. It's all about correcting a very specific, carefully measured problem: chronically low oxygen in the blood, which has a medical name: hypoxemia. Now, we're about to get into the dangers, but before we do, it is so important to understand why this therapy even exists. Because for the right patient, with the right condition, and at the right dose, home oxygen is nothing short of a medical miracle. It's a true lifesaver. So, who actually benefits from this? Well, the guidelines are incredibly specific about this. This is not for just anyone who feels short of breath. We're talking primarily about patients with conditions like stable COPD who have a medically confirmed severe lack of oxygen in their blood. And that's the key. A doctor has to have measured their blood oxygen and found it's dangerously low, even when they're just sitting and resting. And let's talk about that number again: 15. 15 hours, that number is absolutely crucial, because the studies show that for these specific patients, using oxygen for less than 15 hours a day, well, it just doesn't give them that proven survival benefit. Think of it like a minimum effective dose, just like you'd have with any other powerful medicine. And this quote, right here, this is the whole point. This isn't just about helping someone feel a bit better. It is literally about helping them live longer. The science, the landmark clinical trials, they're crystal clear on this. When it's used correctly, for the right people, this therapy extends life. And that is the incredible benefit that has to be weighed against the risks we're about to get into. Okay, let's pivot to the most immediate and, frankly, scary danger: the hidden fire risk. Now, here's a really important thing to understand. Oxygen itself doesn't burn, but what it does do is act like a super accelerant. It makes other things that can burn way faster and way hotter. In an oxygen-rich room, a tiny little spark can become a serious fire in the blink of an eye. So that leads us to these 3 unbreakable safety rules. And when I say unbreakable, I mean it. Number 1, absolutely no smoking. And yeah, that includes e-cigarettes. Number 2, avoid all open flames. That means everything from gas stoves and their pilot lights to birthday candles. And number 3, use only water-based products. Remember what we said about petroleum jelly? These are not suggestions, people. These are critical, non-negotiable safety rules. And this list just really drives that point home, doesn't it? It's about being hyper-aware of your entire environment. That gas stove you used to cook dinner, a romantic candle on the table, even a frayed electrical cord that could throw a tiny spark. All of these everyday things suddenly become major hazards in a home where someone is using medical oxygen. All right, moving on from fire, there's another danger that's purely clinical, but it's just as serious. I like to call it the Goldilocks problem. Because with oxygen therapy, it is absolutely not a case of more is better. The dose has to be, you guessed it, just right. And here's the reason why that just right dose is so important. It's a condition called hypercapnia. See, for some patients, especially those with certain kinds of COPD, their body's automatic trigger to take a breath is actually driven by having low oxygen. So what happens if you give them too much oxygen? Well, you can accidentally turn off that trigger. They start to breathe less, and when they breathe less, they don't exhale enough carbon dioxide, that CO2 builds up in their blood, and that is a toxic situation.
So yeah, more is definitely not always better. This is the whole balancing act clinicians are trying to pull off. The goal is to get the patient's oxygen up to a safe level without causing that dangerous rise in carbon dioxide. It really shows you this is a precision tool, not just something you can crank up.
This brings us to a really common myth we need to bust. Just because someone feels breathless, it doesn't automatically mean they need oxygen. In fact, if their blood oxygen levels are normal, the guidelines are clear. Oxygen is not the answer. It's fascinating, but things like just having a fan blowing on your face can be more effective for the sensation of breathlessness. Remember, oxygen treats the actual lack of oxygen in the blood, not just the feeling of being out of breath. So let's just state this clearly because it's so important. For the right patients with COPD and chronic low oxygen, long-term oxygen therapy is a proven, top-tier, grade A recommendation. It absolutely saves lives. And then you see this, and it's such a crucial contrast. The very same guidelines give a grade A recommendation against using what's called short-burst oxygen therapy for those same COPD patients, like after they exercise. It just goes to show you that the type of therapy, the timing, the duration, it all matters just as much as the drug itself. Not all oxygen therapy is the same, not by a long shot. So, let's wrap this all up. The big takeaway here is that medical oxygen needs to be handled with care. The central message from all these guidelines is pretty simple. This is a powerful tool that absolutely demands knowledge, precision, and a whole lot of respect. And this table just lays it all out perfectly. This is the key analogy I want you to take away from this explainer. You have to think of medical oxygen exactly like you would any other prescription drug. You know, a pill has a specific reason you take it, an indication. For oxygen, that's confirmed hypoxemia. A pill has a dose, right? Milligrams or whatever. For oxygen, the dose is a specific flow rate in liters per minute. A prescription has a duration, how often and for how long. For oxygen, it's that minimum of 15 hours a day. And of course, every drug has warnings and side effects. For oxygen, the big ones are fire risk and hypercapnia. It's a perfect parallel. So how do doctors get that precision? Well, you know that little clip they put on your finger at the doctor's office, the pulse oximeter? That's really just a screening tool. It's not accurate enough for this. To actually get a prescription for home oxygen, the guidelines say you need a much more precise test called an arterial blood gas test. That's the test that gives the specialist the detailed info they need to find that Goldilocks, just right dose we were talking about. And at the end of the day, all of these rules, all of these procedures, they're all there for one reason: patient safety and getting the best possible results. As the authors of the guideline themselves put it, it's all about improving how it's prescribed, which leads to better compliance from patients and ultimately better outcomes for their health. It's all about helping people. So that leaves us with this final question to think about. If oxygen really is a drug, are we treating it with enough respect? We've seen today that medical oxygen is so much more than just air. It's a powerful prescription with a specific dose, a very narrow purpose, and some very real dangers. And maybe thinking of it that way, as a drug, is the absolute key to using it safely and unlocking its incredible life-saving potential.